The title of my lecture in ICS 2026 is Postpartum Urinary Incontinence and Pelvic Organ Prolapse, a state-of-the-art in prevalence, mechanisms and management. In this session, I will review current evidence on prevalence and natural history of urinary incontinence and pelvic organ prolapse in the postpartum period, integrating data from recent cohort studies and also with our own experience for a specialized perineal clinic. The key topics will include epidemiology and risk factors for postpartum urinary incontinence and prolapse, pathophysiology with emphasis on Levator and sphincter injury, temporary neuromuscular weakness and tissue recovery potential, clinical and ultrasound assessment strategies in the early and late postpartum, and finally, tailored management and rehabilitation pathways and how they differ from approaches in non-postpartum women. You know that ICS 2026 offers a uniquely multidisciplinary platform where urogynecologists, urologists, physiotherapists, nurses, basic scientists, and industry partners can meet around a shared focus on lower urinary tract and pelvic floor disorders. Its combination of high-quality scientific sessions, state-of-the-art lectures, and hands-on workshops facilitate rapid transfer on research into clinical practice and supports harmonization of assessment and treatment standards worldwide. You can't miss this. My name is Cristina Ros and I'm consultant in gynecology of the Hospital Clínic in Barcelona and associate professor of the University of Barcelona. My clinical and research work focused on pelvic floor disorders in women with a special interest in postpartum pelvic floor dysfunction and urogynecological ultrasound. I led a dedicated perineal clinic where we combine clinical, sonographic, and functional assessment to optimize early diagnosis and individualized management of pelvic floor disorders after childbirth.